Today, we are absolutely delighted to have with us Professor Christine Oughton. Christine is very well known to you, many of you here, but it's very much in order to highlight a couple of things about Christine's bio. Christine is a distinguished researcher and academic. She's now Professor of Management Economics at SOAS University of London and a Fellow of the Academy of Social Sciences. Received her PhD in Economics from the University of Cambridge and has held a number of full professorships at a number of universities, including University of Rossano in Italy and next door at Birkbeck University of London. And also held positions as a senior lecturer and director of research center in industrial strategy at the University of Birmingham. And her research is not only interesting, provocative, and impactful, but also cuts across a number of areas, including financial diversity, innovation, environmental management, corporate governance, and financial inclusion and growth. And indeed, was a co-investigator and worked together on the ESRC project. And also, of course, is part of this ESRC research seminar series. And also has worked on a number of ESRC projects, including the one I've mentioned, the ESRC Financial Inclusion and Growth in Low-Income Countries, and also another joint project in which we are co-investigators on the financial systems in China. Christine has published quite a huge volume of work, very high-rated pieces of work, mainly on the key research areas I mentioned, including innovation, environmental sustainability, which is, of course, a big issue today, governance, financial diversity, competitiveness, and growth. And in particular, in these areas, she has also led impactful collaboration with a number of important policy organizations, including her appointment in 2017 as a research fellow at the South African Reserve Bank. At the moment, she also sits on the board of directors of the Financial Inclusion Forum in the UK and the Academic Industry Research Network. Christine has also been very fundamental in promoting the activities of SOAS, and indeed, excuse me, and indeed between 2012 and 2016, was the head of the School of Finance and Management, in which this research center is based, and also served on the SOAS Board of Trustees. I could go on and on and on about the great contribution that Christine has made, but I think I would be depriving you of the knowledge that Christine wants to share with us today in an extremely interesting piece of work about the patents paradox in the era of COVID-19 and the climate change, which is number 2 risk. So she actually has addressed 2 big risks that are identified. Risk number 1, COVID-19. Risk number 2, climate risk, climate change risk. So, Christine, I don't think I can replace the presentation you want to do. It's a great pleasure to invite you, Christine, to go ahead and present your seminar and research paper with us. Thank you very much. Let's all welcome you to the seminar. Thank you.
Thank you so much, Victor. Very kind introduction. I don't know if I can live up to it, but I'll have a go. So I'm just going to share my screen. So I hope you can all see the first slide.
Oh, yes, we can. Yeah. Absolutely.
Okay, so first thing is to say that I'm going to talk about the patents paradox in the era of COVID-19 and climate change. And the purpose of the paper is to try and get to kind of more nuanced perspective on patents and develop a patents taxonomy. I couldn't have done this without my colleagues, Juana Bustamante from Vergata University, in Rome, Vanesa Pesque-Cela, some of you know, who's still at SOAS, and Damian Tobin, also one of our colleagues from SOAS. So unfortunately, they're all kind of teaching at the moment, and Joanna works for the World Health Organization, can't be here with us, but I'll do my best at presenting the paper. So just a very quick outline. I'm going to run through an introduction, a bit about the patents debate and what it's about, and then go towards sort of trying to develop a more conceptual framework towards a patents taxonomy. And then with this taxonomy in mind, to sort of bring empirical evidence to bear on it, using two case studies that each embodies a natural experiment, which is the development of vaccines before TRIPS, in the International Agreement on Intellectual Property Rights and Trade, and also and after. So the vaccines like the polio vaccine were not patented, and of course all of the COVID vaccines are patented. So what's the difference between these two cases? And the second case study is environmental technologies. These are technologies to reduce emissions under two international agreements of the UN, the Montreal Protocol, which is widely regarded as the UN's most successful environmental agreement, and the Paris Agreement that we're all familiar with, that was discussed again at COP26 in Glasgow just last year, and then make some conclusions for policy and applications. So the rationale for patents, I mean, one of the best explanations for what's going on with patents is, I think, this quotation from Joan Robinson, which does show that, you know, even back in 1956, there was no consensus really on patents. And has to be said that although we have agreement in policy, there isn't agreement in the academic literature on the rationale for patents. And it's kind of summed up in this quote. And she says, this leads us to what we may call the patents paradox. A patent is a device to prevent the diffusion of new methods before the original investors recovered profit adequate to induce a requisite investment. The justification of the patent system is that by slowing down diffusion, it ensures there'll be more progress to diffuse. And since it's rooted in the contradiction, there can be no such thing as an ideally beneficial patent system. It is bound to produce negative results in particular instances, impeding progress unnecessarily, even if its general effect is favourable on balance. So that was, I think that's a really good summary of it. And I think she did coin the term paradox of patents. And then there's another quotation from Edith Penrose, a co-author, Malcolm, that says, to say patents are effective incentives of economic activity is one thing. It's quite another to contend that they're necessary for inducing an adequate amount of such activity. And that's because there are other ways of financing R&D activity. And we know that a lot of R&D is financed by government and not by the private sector. And also there are other mechanisms like prizes and patent pools that can do the same job as patents. And then this final quotation is from Kapp, from his book, The Social Costs of Business Enterprise. And he's really, he covers all kinds of social costs, health costs, environmental costs, very much focused on environmental costs. He's really ahead of his time, actually. And the problem he's alluded to is the fact that given that firms don't pay the costs of pollution, they don't really have any incentive to reduce pollution. So there's principles of business enterprise, profit maximization, I guess he's alluding to, favour the emergence of social costs of air pollution. Industry does not spend considerable sums dealing with the prevention of social costs because they don't pay the costs. The costs are transferred onto society. So it's clear when you look at, these are big names in our field. It's clear when you look at the literature, there never was a consensus over the role of patents and how they would work. So the system of IPR introduced under TRIPS, which is remarkable that we've got this international agreement, that is now over a quarter of a century old, it was all the more remarkable because it was achieved without any consensus on the value of patents for society. So you've got this case where policy hasn't reflected, as Keynes would have us believe, or that Keynes claimed, that the voices of some academic. The policy was made despite the lack of agreement over TRIPS was made without an agreement in the academic literature on the role of patents. And so we're much closer to something like Nick Stern's address to the European Association of Economists, when he said that it's the other way around. Keynes's quotation, very famous quotation, that policymakers are slaves to academics. Actually, many academics and policymakers, that it's blurred, that relationship, and policy is made without reference to academic work often. So that's an interesting take, I think, that Nick Stern has on all of that. So I think in this paper, we really want to think, is this patent system fit for purpose then to meet 21st century challenges of COVID-19 and climate change? And so we revisit this patents paradox and the controversy and consider the role of patents and their impact on society for a particular class of inventions. And it is inventions that are designed to protect common pool resources, such as public health and the environment. So a common pool resource is something that is non-excludable. I can't stop you from using it. I can't stop people, if I'm giving this lecture live, coming into the room who may have an infection. It's kind of non-excludable in that way if it's a public lecture. And it's subtractable. So if I use up the clean air in the room, it can have impacts. There's less clean air, and therefore the risk of infection for other people is greater. And it's that public health argument around vaccines. And the same for the environment. If I emit carbon, it subtracts from the atmosphere, the quality of the atmosphere. And I can't stop necessarily people emitting carbon. I mean, this is the whole point around policy. We've got to deal with these issues. So there's certain inventions that can protect common pool resources, like vaccines would be one technology that can do it, or like green technologies and for green vehicles. And so we focus in particular on this group of inventions to protect common pool resources. But we look at a broader taxonomy, actually, of patents for different classes of inventions, and I'll go through some of them, but our focus is really on these ones to protect common pool resources. And then we use game theory to explore some of the anomalies raised by common pool resources, because they have another thing that characterizes them, is that they're subject to the tragedy of the commons, where we could all be better off if we could agree things. But if we act in a self-interested way, we end up destroying public health and the environment. So this is a very special class, in a sense, of common pool resources, very special class of resources. But very important, as we know now, to our cost. And so it's very hard to bring empirical evidence to bear on these big questions. So we've decided to focus on two case studies as natural experiments. I mean, you may have seen that this year the Nobel Prize went to a group of economists who've been using natural experiments. These are experiments that occur naturally, so we can look at vaccines pre and post TRIPS. It just happens that TRIPS was introduced, and we've got evidence from the development of vaccines pre-TRIPS. And we can also look at the development and diffusion of green technologies under different UN agreements. One, the Montreal Protocol, that has a very clear commitment, legally binding commitment to reduce the emission of CFC gases. These were causing a hole in the ozone, holes in the ozone layer. And the Paris Agreement, which is very different because it's not focused on preventing emissions of greenhouse gases. It's got a target that is to limit global warming that nobody is in control of individually. So you can't say to a country, you've got to reduce your greenhouse gas emissions by X amount. It's up to, I'll explain how this works, but it's a much softer agreement. It's a very different type of agreement. And then we'll consider the policy implications of that. So I guess we're all familiar with R&D and patent issues. R&D is very costly. The returns are very uncertain. If you do nothing, there's a chance that you can get underinvestment in R&D. And the one solution to that, but it's only one solution, is that you can introduce patents, and these allow monopoly profits, normally for a period of 20 years. It increases return to R&D. It enhances technological progress and raises living standards. And patents also have another advantage. They do put information in the public domain, because you have to say, when you apply for the patent, you have to set out the technology. So it does, but you have the control over that technology. And other people, provided you can enforce the patent correctly, have to license it and pay you to use it. So patents are predicated on this trade-off between static and dynamic efficiency. We tolerate high prices and restricted output now for higher living standards in the future. That's the idea. There are other ways, of course, to deal with the underinvestment problems that I've alluded to. Patent pools and prizes or government funding will do the same thing. And you can all use a mix of these policies, or just focus on a single one. I mean, governments are actually doing a mix of these policies. So we get this position, you know, the standard justification for patents is you go for dynamic efficiency and you sacrifice static efficiency. But as Robinson pointed out, a patent system is bound to produce negative results in particular instances. And there's something very peculiar about vaccines and green technologies. They are a very particular instance, because so what did Robinson say? You slow down diffusion in order to get more innovation now. But the problem with vaccines and green technologies is that their efficacy, how well they work, depends critically on rapid and extensive diffusion. So if you slow down diffusion of vaccines, you actually undermine the effectiveness of the vaccine. If you slow down the diffusion of green technologies that reduce CO2 emissions, you actually reduce the effectiveness of, there are tipping points, I don't want to go into the environmental science of it, the tipping points in the build-up of CO2 emissions. You actually reduce the effectiveness of the green technologies. So delaying diffusion is counterproductive, and actually it makes no sense. And that's not the same as a patent for a vacuum cleaner, where if you patent it, it doesn't matter if you slow down diffusion. I mean, it doesn't matter in the sense it doesn't mean the vacuum cleaner doesn't work. So we need to speed up diffusion for vaccines and green technologies to make them as effective as possible. And that's an unusual, very unusual situation. I mean, this is a paper actually with our colleagues Desiree Kanga and Lawrence and Victor here, that we did just plotting the diffusion mobile phones. You can see how long these diffusion curves are for products. And also this is just showing it by high income and low income countries, how hard it is to diffuse technologies even after patents have expired in low-income countries. So that says something more about that. It's not just patents, it's other things as well. But it just gives you this kind of S-shaped diffusion curve, which you may also notice is the same curve that we've observed for the diffusion of COVID-19 infections, is very common for many, many innovations. They tend to follow this pattern. So we want to make that curve, we want to diffuse really quickly, and it's hard to do that. So what is the existing state of the art and empirical evidence on how the patent system has worked? You know, are patents necessary and sufficient condition for innovation? Well, when you look at the empirical evidence, it's actually interesting, because many countries in the 19th century industrialized without patent laws. Switzerland was one, Netherlands was one. The consistency of patent laws is a very recent phenomenon, actually, just in the 20th century. And if we look at cross-country evidence, and it's a nice study by Quan that's looked at this from 26 countries, what they've showed is that pharmaceutical patent protection alone doesn't stimulate domestic innovation. And it depends on a number of other factors: economic development, educational attainment, the institutional environment, all the other things that we know that can be really important for encouraging pharmaceutical development. It has to be said that the amount of money spent by pharmaceutical companies on vaccines is much less than on other drugs. I'll just leave that thought with you about why that might be the case. And then if we look at industry level evidence from the US, we find that R&D labs in most industries use mechanisms other than patents to appropriate returns from innovation. They try and keep things secret, or they try and build up brands and so on. So it's not, it's not just patents that is going to be doing the job anyway. And then there's some evidence that patents can deter innovation as well. Lerner in 2002 examined shifts in the strength of patent protection across 60 countries and concluded there's a sort of inverted U shape between patent strength and innovation. Increasing patent protection beyond a certain threshold is detrimental to innovation. And if we look at industry level evidence, a nice study by Dozy and Stiglitz in 2014, they show that tightening the patent regime in a country has sometimes been followed by a fall in the rate of innovation, in the US, a fall in the rate of innovation. In the area of biomedical research, the proliferation of patents has created barriers to further R&D as too many owners block each other. So you sort of get this inability to develop anything around the original patent because of the way you have to pay a tribute. This is one of the reasons why the Salk's first polio vaccine may not have been patented, that it was difficult to do it because of what had gone before. So this lack of consensus, both theoretically and empirically in the academic literature, remains. Patents depend on weighing costs and benefits. And what's also interesting is that in the beginning, the US Patents Act in 1790 tried to do that. It tried to look at patents on a case-by-case basis and weigh the evidence for and against. But that's extremely difficult to do, and to see whether they're in the public interest. That's extremely difficult to do. So the emphasis shifted. They abandoned that really. It was just not practical. The emphasis shifted towards property right infringements, so very much a legal focus of patents. There's a nice paper by Bajoli who argues we need to go back to a more nuanced assessment of patents, and perhaps we could do that by an industry-specific approach. And sort of building on that, what we're arguing is that we could set out the taxonomy of patents from technologies for standard goods in competitive markets to common pool resources that are non-excludable and subtractable, like public health and the environment. So to help with that, I just want you to think, is a patent going to have the same effect for a vacuum cleaner and a vaccine? They are so different in their characteristics that this one-size-fits-all patent law really, I can see why Bajoli is saying you need a much more nuanced approach. And so we've tried to sort of set out what such an approach, given that we can't go to case-by-case assessment, what such an approach might look like. And I'm not going to go through this table in great and minute detail, but I do want just to draw your attention to the first and the last one. I might say a little bit about network externalities as well. So if you think of a non-essential good, might be a turntable to play records or a food mixer. We don't need these goods. We can have a hand food, or we can have a whisk, and we don't need a turntable to play music. They're non-essential. The benefits of the patent is that it does provide higher profit to the owner. It does spread codified knowledge. When you apply for the patent, you must show how the technology works, and people can see that. It's in the public domain. The costs of the benefit system are higher prices, lower output, and slower diffusion of these of the best technologies. And buyers can switch to other products as well. So the question that we're really interested in is, does patent slow diffusion reduce the efficacy of the invention? And are patents the best tool to induce R&D? So I think for the food mixer, having the patent doesn't make the food mixer work any less well. And I don't know, patents may be a good tool for R&D. It's a bit of an open question. There may be other ways of dealing with the investment in knowledge creation. But patents is one of them, just not the only one, as we knew from Malcup's and Penrose's work. And then when you get to essential goods, it's a bit more complicated here because, water purification technology is pretty important. Clean water is really significant. But the technology itself won't work less well if you have a patent. It doesn't undermine the way that technology works. It doesn't depend on rapid diffusion. But when we start to get to charging points for vehicles, okay, so companies making the electric charging points for vehicles, this is a product that has network externalities. The more charging points there are for vehicles, the more demand there'll be for electric vehicles, and the more demand there'll be for charging points. So this also has positive externalities. It will lower emissions as well. So we've got a more complex case here. And lower output and slower diffusion means you can get stuck with a sort of non-favorable technology. So it does kind of undermine the efficacy of the invention or the technology. You're not going to get the economies of scale you get or that you need for this product. But the one we're really interested in is this common pool resources, health and the environment. So examples of vaccine, low carbon technologies, they have another benefit, which is increased life expectancy and well-being. And also, I mean, if you look at the pattern of deaths from COVID-19 and the pattern of deaths geographically from the effect of global warming, it's the same. I mean, the costs are falling. Sorry, if you look at the diffusion of vaccines and the pattern of deaths from pollution, you see the same pattern. Okay, the low-income countries have the least vaccines, they're least protected, and in terms of green technologies, they have the higher costs from pollution. They're bearing the costs of pollution, even though most of the pollution is created in high-income countries. In this case, there is no question that slowing down diffusion reduces the efficacy of the invention, and patents are not the best tool to induce R&D for these goods because they slow down diffusion. I mean, there is provision under TRIPS for compulsory licensing, and that has been used. But before you can use a compulsory license, you have to try and negotiate a deal with the owner of the patent. And there has been some success in the paper. We look at that for HIV drugs. There has been some success in using that, but it's not the same as having a patent waiver, for example. So if we look at these taxonomy towards the end, and I really want to focus on 6, the efficacy of the product is really undermined. The efficacy of the vaccine is undermined. And that's exactly what we've seen with Omicron. If you don't diffuse the vaccine quickly, you get mutations in the unvaccinated population. And the same with diffusion of green technology. If you don't diffuse that quickly, it allows more carbon to accumulate in the atmosphere. And there are tipping points on those carbon accumulations in the atmosphere where things really start to get serious in terms of the effect on climate change. So the other thing about these, it's not just that they're in this common pool resources are in this strange category that the technology, failure to diffuse the technology quickly undermines its effectiveness. There's another problem, which I guess you're all familiar with, which is the tragedy of the commons. And here I'm going to show you my holiday photo from last summer in the Highlands of Scotland. I was very pleased when I saw this notice, because there's still common grazing lands in Scotland and in England where the idea is that the community own the land, and there's a private incentive for everyone to overuse the land and put their cattle on all the time, and the land gets destroyed, which is exactly Hardin's tragedy of the commons. Quite nice quotation from him: freedom in the commons brings ruin to all. That if everyone disregards the common good, then you end up with the common good being destroyed. So what's interesting about this photo is that notice was in the little village of Durinish. I drove through in the morning, and there are about 10 cattle on the common pasture land, and there's some of them in that picture at the bottom, Highland cows. When I drove back 3 hours later, they'd gone. That community has high levels of trust in the community. They agree how to share this land, and it is used as common pasture land. It's easy to get to that agreement when you live in a very small community. It's much harder, of course, to do it internationally, but it has been done. As we know in the Montreal Protocol, it has been done. So if you look at these, let's just look at this kind of vaccine game, and this is sort of drawing on work from the Duke Global Health Centre, John Hopkins, and a paper by McCadden, published in Nature, I think. We can see that the vaccine distribution, if you like, is an example of a tragedy of the commons. So in this game, countries, it's a gameplay between countries, because most of the purchasing of vaccines was done by countries. Okay, so countries made these advanced purchase agreements, APAs, and they made them bilaterally. So the UK made a number of them, and actually the UK did extremely well in terms of identifying. You had to pick the winners, if you like, of which of these vaccine projects. Nobody knew if any of them would work. Kate Bingham was the person who was a scientist working in government, and she made good selections of the vaccines. But how the advanced purchase agreement works is the government strikes a deal with a company and agrees to buy a certain amount of vaccine, normally millions of doses, for a certain monetary value. If the vaccine is successful and is approved, they get that agreement, the number of vaccines agreed. If it's not successful, they don't get the money back. That's how a lot of the R&D in vaccine technology was financed, through these advanced purchase agreements. Plus, a lot of R&D in this field is financed with government funding anyway, and some of it is funded by privately by companies. But by the vast majority, it was funded through APAs and public funding. So each country can choose one of two strategies. It can choose to strike bilateral deals, or it can choose to strike a multilateral deal. And COVAX, set up by the World Health Organizations and UN, was one of the vehicles to encourage multilateral deals across countries. It's a cooperative strategy. So you agree to buy the vaccines cooperatively and share them equally. Now, clearly, if everyone does that, you get an equal distribution of vaccines, and you've got more chance of preventing the development of mutations. And so the highest payoff available jointly is this one here. Doesn't matter what these numbers are, they could represent 2 billion. What matters is their relative structure. So this is a classic example of prisoner's dilemma. If countries act in the common good, they will go here. If they act in a self-interested way, they will go here. Most countries did a bit of both, but very heavily tilted towards, in the case of the UK, bilateral agreements. I mean, we purchased enough vaccine, when I look at the figures on the UNESCO website, to vaccinate everyone 10 times over. And other countries, low-income countries, have not got sufficient vaccine. And there's issues around the COVAX vaccines as well, that I'll come on to, because there's issues around expiry dates and storage and so on. So if you don't do anything, if you can't get an agreement, you're going to end up here, where where we could all be better off if we end up here, and that's the tragedy of the commons. So if you can institute some kind of patent waiver and build technology capacity in low-income countries, you can even get a better outcome, because the other constraint is not just the patent, it's that we don't have enough places to make the vaccines. So this payoff from being cooperative in a deeper sense, having the patent waiver and technology capacity, the collective payoff increases even more. And you would get all kinds of benefits, actually, including greater equity. If you could, so one thing that SOAS is trying to do is build partnerships with universities in low-income countries to spread technology, increase innovation globally, particularly in low-income countries, and therefore increase income in low-income countries as well. So all kinds of benefits could come from this. If we look at the situation with low zero-emission vehicles, you get the same. Now, this is a gameplay between firms. If a company switches to, so each company has got two choices. It can continue with high emissions technology, petrol and diesel cars, or it can switch its production to electric vehicles, which have been around in production and commercially since 2000. But I'll show you the figures on diffusion. Hardly any country has got more than a few % of electric vehicles. Diffusion has been incredibly slow. You can continue with high emissions technology, as all the car companies have done, actually, or you could switch. The trouble with switching is that there's huge economies of scale in car production. So if you don't have a big market for electric vehicles, you're going to end up with higher unit costs. Electric vehicles are more expensive, can be much more expensive. So you need everyone to switch together. And that's why if everyone switches together, you can get here and much higher payoff. And of course, you need the networks as well. You've got the network externalities in there as well, which is some of the points as in the taxonomy that I showed you earlier. So the problem is that we end up here if companies follow individual strategies, whereas if we could agree to prohibit, as some countries have done now, prohibit the sale of petrol and diesel vehicles by a certain date, you might be able to get here. But you need some mechanism to shift you, just as you need a cooperative agreement on vaccines to shift you, you need some kind of cooperative agreement on emissions to shift you to that outcome, the better outcome here. So I just want to run through very quickly before concluding some evidence from these two natural experiments we've identified, which is the development of vaccines pre-trips, the polio vaccine, and the development of Covid-19 vaccines, which are post-trips. The polio vaccines developed by Salk, Goldblum, and Sabine developed the oral version of the vaccine, which is really important actually in making it easily accessible, particularly in low-income countries. They were all developed without patents. And of course, we've seen that the Covid-19 vaccines are developed with patents. The AstraZeneca vaccine developed with Oxford University and AstraZeneca, they agreed to sell at cost, whereas Pfizer and Moderna are selling, including, and I've recently, you may have seen the CEO, I think, of Pfizer saying, look, it's justified, we've saved so many lives and so on, that they're selling it at a premium. And then that's the first case study. So development of vaccine without a patent and development of vaccines with patents. And then the second natural experiment is looking at environmental technologies, new products, new versions of CFC gases that were less ozone depleting, which was triggered under the Montreal Protocol, signed by every member of the United Nations, and with a very binding constraint to clearly stop emissions of the worst polluting CFC gases, or worst ozone depleting CFC gases, and compare that with the development of low and zero emission vehicles, which I've told you were around commercially in 2000. I mean, the discovery was much before that, under TRIPS and the Paris Agreement. So let's have a look. So the vaccines, the polio vaccine was developed without patents. There were very high levels of knowledge exchange and technology transfer across countries. I mean, it really was international what was going on. I'll explain one of the international dimensions was the work of Goldblum, who was a scientist in Israel when they had an outbreak. And he went over to Salk's laboratory and worked with Salk in the US, learned the expertise, took it back to Israel, and very quickly they were able to really bring outbreaks under control. And then, of course, Sabine's work on the oral vaccine, which was a lot of that was developed. He was living in the US, was developed in Russia. That had huge benefits because it could be used and it could be disseminated very quickly because it was just, you didn't require nursing staff to deliver the vaccine. So there was innovation around the vaccine, you know, from the original vaccine to the development of the oral vaccine. All of that was done in the public domain, and the knowledge was shared. And it was transferred via international networks. If you look, this is a little bit from a paper published in the World Health Organization Bulletin. This shows what drove this in Israel. Well, the first wave is this one with the crosses, 1952 to 56. You've got to remember that Israel wasn't a high-income country at this time. And they had this peak in polio cases. And then they sent Goldblum over to the US. He did his work. They came back. They learned a lot about the vaccine and how to deal with it and so on. And they managed to bring down cases. Then they had a second wave. That second wave here in 61 was mainly in the unvaccinated low-income populations. And there, the oral vaccine, you see the effectiveness of the oral vaccine. The oral vaccine was used as a way of distributing the vaccine in poorer areas. So that development of the vaccines collectively did lead to fairly rapid diffusion. You've got to remember the vaccine technology itself was quite new then, far from what it is now. In contrast, this is the vaccine supply. This is data from UNICEF's website. Here's the block agreements by the European Commission, COVAX, what's donated to COVAX, the USA, the UK purchased 629 million doses of the initial vaccines that were released. Whereas it's worth looking at this website. If you go further to the right here, you can see for every country that the distribution is so heavily skewed towards high-income countries. It's not, it's just not going to deal with the, well, we've seen what's happened with Omicron, deal with the issue of mutations in the unvaccinated population. So that is, looking at if we could come to some agreement, okay, if COVAX could work effectively, obviously, it's great that COVAX has got this many, but it needs far more. And the problem with what's been lost in having everything patented is one of the barriers to rapid diffusion is the need to keep these vaccines in very low temperatures. And the other thing that we've heard reports of is that many of the vaccines that have been donated to COVAX have been donated late. And they're past their expiry date, or not past it, but so close to expiry date that they can't really be distributed. And then therefore some of them are really being wasted, which is tragic. So let's look at this second case, CFC gases under the Montreal Protocol. These are the gases used in refrigerators, aerosols, and so on that are very common. And then scientists noticed a hole in the ozone layer, and the Montreal Protocol was agreed. And compare that with what's happened under low and zero emission vehicles, where we've had the technology for 20 years. And most countries have got less than 1% of vehicles that are low and zero emission. And that's developed under TRIPS and the patent agreements. Of course, these hybrid technologies, which were the first ones, were patented, and that was one of the factors slowing down their diffusion. So the Montreal Protocol set a 10-year target for developed countries, but it was a binding target. It was different for, which is one of the reasons for its success, it was different for developed countries who are the main emitters and developing economies. But the agreement was and every country signed this agreement. Not every country signed the Paris Agreement, nearly everyone, but not everyone. Every country signed this agreement. The agreement was a 10-year target for developed countries to cut CFC gas emissions by 50%. In fact, despite protests at the beginning, it wasn't easy to get that agreement, I have to say. I'm making it sound easy. It took years to get there, but not that long, you know, in terms of where we are with climate change, with greenhouse gas emissions. That target was met in 3 years, and I'll show you the graph. It's really quite dramatic. So, you know, companies said we can't do this, but actually this binding commitment focused minds, and they did it because it's easier to all switch together. So the target was met in 3 years. Why and how? First of all, binding deadlines to phase out CFC gases, a robust system for measuring CFC consumption by country. So countries had to report on this, it had to be verified and so on. Explicit recognition of differences between developed, who are main emitters, and developing countries, who were given longer to adjust and financial support, and a multilateral fund to provide technological assistance to finance the creation and diffusion of replacement gases, including, they've only just very recently published what this financial assistance in detail was used for. A lot of it was used to pay patent fees to Dupont was one of the main companies, to the rich companies registered in rich economies in order to license the technology for CFC, for less ozone depleting CFC gases. So this is the effect of that policy. It came in around here, and within 3 years it was almost CFC gases in developed. This is the developed economies. Now the most polluting ones have gone. There's still some that are less polluting. And then developed economies, their emissions were rising from a very low level. And then when they were diffused, they followed the same downward trajectory. So a very successful policy. So if we compare that with what's happened under the Paris Agreement, if we compare, the Paris Agreement was agreed in 2015. It didn't express the targets in terms of cutting emissions of CO2 by a certain percentage within a certain time. It's got these targets that are, I would call them collective targets, because no country is in control of them. It is to lower global warming to 2 degrees Celsius above pre-industrial, to limit global increases in temperature to 2 degrees Celsius above pre-industrial levels, and ideally to further limit it to 1.5 degrees Celsius above pre-industrial levels. So the targets are not expressed in a measure that individual nations control, and they're not legally binding, nor enforceable. And there's another kind of target as well in there, a target and an instrument, which is that developed economies were to deliver 100 billion per annum of finance to developing economies from 2020 to 25. That target has been, that is a clear, firm target. It's been missed. So what are the instruments then in the Paris Agreement? If it's you've got this strange target that everyone is in control of, and therefore no one is in control, it's nationally determined contributions. It's a process. It's plans, and so each country must express its plans to reduce, decide how it's going to reduce its carbon emissions, and submit those plans. And then we add them all up and see if it adds up to minus 1.5 degrees, you know, limiting climate change to plus 1.5 degrees Celsius. The 100 billion per annum of finance from developed to developing economies, climate justice, it should be, you know, polluter pays principle, the need for GDP to rise in low middle income countries to reduce inequality. This target is laudable, but it hasn't been met. And I'll show you the figures on that in a second. There are some other instruments in the Paris Agreement that are interesting, Articles 6.8 and 6.9, which depend on non-market approaches for mitigation, technology transfer and capacity building, but they've not really been used. And limits, they've not been used. And there's a lot of discussion about those at Glasgow, but not much progress. So if you add up all the nationally determined contributions, this is where we need to reduce these emissions. If we want to get to 1.5, just limiting climate change to 1.5, we need to reduce carbon emissions following this blue trajectory, or turquoise trajectory. We've even missed the higher target of limiting climate change to 2 degrees Celsius. This is where we are if you add up the nationally determined contributions that have been submitted. So we're way off missing these targets because, you know, the targets aren't really binding targets. They were there to get an agreement, but it's we need to do a lot more. And then on finance, this is showing that we're still short of the 100 billion needed. I mean, these are the latest figures published last year. These are the most recent figures we have. The other interesting thing about these figures is that there's a lot of loans in there, and most of the loans Oxfam has estimated are above market rates. So, you know, to sum up, the 1.5 degree target is unlikely to be met without a regulatory spur to innovation and technology diffusion by the kind of thing we had in Montreal, which could be done under Articles 6.8 and 6.9, but they would need, it's not being done at the moment, they would need wings. Oh, don't know, sorry, I need to switch this off because it's going automatically. Yeah, so the market, let me just, this is the market share now, just looking at hybrid electric vehicles in the United States. And the key message to take away from this graph is that even in the US, where the technology was first kind of commercialized in California because of very good regulations in California that encouraged clean vehicles. Only if you add up all those different types, hybrid, plug-in electric and electric, only about 7.6% of the market, 20 years after this technology was introduced, is clean vehicles or cleaner vehicles. If we look at California, there's another little natural experiment where the legislation has been much stronger. You know, California's relatively environmentally friendly state in an environmentally unfriendly nation state. California's got about 15%. So even California's done twice as well as the rest of the US because of it's got stronger regulation, but still it's low. And the country that's done the most is Norway, and they've just introduced very tough limits. And you see that for other countries, these are tending to be higher income countries. Still, most of them are well below 5%. And China has done, of the emerging market economies, has done well, but it's still less than 5%. So we've got a technology we've had for 20 years and we can't diffuse it. The new CFC gases that were developed under the Montreal Protocol were developed and diffused in 3 years amongst developed countries, and longer to developing economies, but not that much longer. So to sum up, we need a more granular approach to patents than the one-size-fits-all model. Compulsory licensing takes time to access and it still involves costs. And drawing on our taxonomy, we conclude that inventions to protect common pool resources should only be granted, or patents should only be granted, where proven benefits for public interest and diffusion mechanisms exist, knowledge sharing and patent fees refunds under the Montreal Protocol. Gavi's highlighted a lack of progress in vaccine building capacity in lower middle income countries. You know, we suddenly realize it doesn't make sense to have all the vaccine capacity in high income countries or other supply chains for that matter. And regulatory instruments such as binding commitments to phase out petrol and diesel vehicles can act as a spur to innovation. And this is the Porter hypothesis that was used in the Montreal Protocol. So the Porter hypothesis is that if you set a binding agreement, it's a kind of Ulysses and the Sirens type argument, if you set a binding agreement to limit something by a certain date, it acts as a spur to innovation. So initially on CFC gases, the companies were reluctant, but in the end, it worked to their benefit. I mean, they profited from this shift to the new technology. And California and Norway have done similar things. I mean, Norway much more so than California. Norway's now phasing out petrol and diesel vehicles, and that is what's led to that big spike in the adoption of cleaner vehicles. In the case of vaccines, I think that we think from the patents should be automatically waived as soon as WHO declares a pandemic, and be accompanied by technology transfer policies and building capacity and transferring knowledge from, mostly it's from high income to low income countries, but from whoever has the knowledge, doesn't have to be that way, to spread and diffuse the relevant expertise very quickly. And that requires strengthening international governance and cooperation. It's not easy, and you may say I'm a dreamer, but we did it under the Montreal Protocol. We are desperately in need of doing it now, and COP26 has made some little progress on that, but we need to speed up progress. I think at least, if nothing else, there's a recognition that we need to speed up these agreements. So I'll stop there and take questions. Yeah.
Thank you indeed, Christine, for such an exciting presentation. That's my applause to say a very interesting piece of work, very addressing contemporary issues on the patterns with respect to the two most potent risks today, COVID-19, and then of course also with the climate risk change. And I think what is particularly interesting in your work is the body of evidence that you have put together, a very thorough research going way back to where the ideas of patents dating back in 1956 up to, so you've been able to comb the entire literature to see how the ideas have developed over time, up to the introduction of TRIPS in 1994, effective actually 1st of January 1995. It created a big watershed on the introduction of WTO. And then also generating some, very plausible observation. I absolutely agree with the main observation that a granular approach to patents is what is required today, rather than a one-size-fits-all. And that paves the way to understanding the policy. And of course, I can see a lot of future work originating from this. Already you have started my brain working so fast. And I'm going to put a proposition that actually maybe the source of finance for the investment that goes into the patents does matter. For example, I can think that if the R&D that is patented is going to be funded 100% by governments, then of course it's likely that that technology can be shared, globally. And also, as you see, the example of bilateral versus multilateral, it depends on which government's going. But if, say, for example, the pool of COVID-19 vaccines was funded from multilateral funds, that would make it possible that there is no need for protecting the patents. The problem comes if specific pharmaceuticals or private companies are involved, and I think that's where I started to think about maybe the source of funding that for investing into the R&D, does matter. Private firms will need to recover their investments, governments may not. And then you have, of course, the mix of funding, 30% governments, 20% private sector, and so forth. I know this was not covered. I'm just mentioning that that's my brain working on what other new innovations to can be extending this work. And also, I think we can also talk about the methodologies of evaluating natural experiments. But let me open the discussion to the floor for comments, feedback, questions. I did prompt putting some work in the chat, but I didn't say any. So, but good, I can see a hand going up. Let me first change my screen so that I can very well monitor the, okay. So the first interaction is from Anthony Julis. Anthony, please go ahead. Give your feedback.
Thank you. Thank you very much, and compliments to all of you for the new year. I hope you can hear me clearly. Thanks,
yes, very well indeed.
Also for the presentation. Just a very quick question. When it comes to common pool resources, in the lead up to the conclusions, there's a lot said about payoffs and benefits and collective payoffs and collective benefits. But when it comes to the actual measures, it's around collective targets. And so the question is that not the crux of the problem, that we are measuring targets in terms of achieving certain things as opposed to what I would argue should be measured are collective benefits, and what would be those measures, the actual measures of collective benefits, because there is no conclusion now, even though you may achieve the targets, that the benefits that lies behind are also simultaneously achieved. So the question is, should we not be moving from collective targets to collective benefits or collective payoffs? Thank you.
Thank you very much, Christine.
Yeah, no, thanks, Anto. It's a good question, and I kind of glossed over it. So thank you for that. Yeah, so on the collective benefit, if you think of something like the vaccines, there have been a number of studies, a really good one actually. Now I can't find, I'll find the reference for it and tell you. It's economists at the National Bureau of Economic Research that showed that with the vaccines, it actually makes sense because of the costs. Okay, so you need to measure the costs, you're right, Anthony. You need to measure the costs of not having vaccines, if you like. And you can measure it in two ways. One is loss of life. But economists, it's very hard to put figures on that. But the other way to measure it is in loss of GDP. Loss of life is more serious, but the loss of GDP. So there's been a study done that's tried to estimate the loss of GDP from COVID-19. And that study showed that the loss to the rich countries in terms of GDP from not distributing the vaccines evenly was much greater than the cost of just distributing the vaccines evenly and doing the right thing. So you can get an economic measure of it like that if you wanted to. The other way to measure it would be lives saved, which is significant as well, obviously much more significant. But even for economists who are keen to put monetary values on things, it's that study shows, it's actually cited quite heavily in the Financial Times as well, shows that it's in rich countries' interest to distribute vaccines to low-income countries, and we'll all be better off from doing it. In terms of the car manufacturers, if they all move together to shift, if only they could all move together to shift to cleaner vehicles, they will all do well in terms, they could have done well economically, privately, economically, in terms of car production. The ones that, the difficulty of doing that is it's more expensive to produce these cars than it is to produce, particularly when the volume is low. problem gets much better when you have high volume of production because of economies of scale in car production, but they all need to shift together. But the thing we can't measure on car production, just like we can't really put a value on health, good health, and even nebulous things like the loss of mental health and so on from COVID-19. Perhaps it is, it's difficult to assess these things, but on car production, the thing that we need to measure is the reduction in emissions and the cost to society of climate change. Now, it's quite hard to measure the cost of climate change, but what we do know is there are people that have tried to estimate it, and there are estimates of loss of life from climate change as well. But the estimates, there's no point in trying to, countries in the global south where they're at different stages of development, if farmers get all of their good work swept away because of climate change caused by countries in the north, and they're back to square one and they don't have good insurance protection systems and so on, then that is a real monetary cost to those countries. So I think it is possible, Anthony, to answer your question, to measure the economic costs. And then there's also the sort of non-economic costs in terms of health and well-being and lives, which is harder to put a value on. Even if we could bring together evidence to bear on the economic costs, it would show that it's in our interest to deal with these problems. It might help concentrate minds. So it's a very important question.
Thank you. Thanks.
Thank you, Christine, for that response. And so let's see any further comments. Yeah, Kieran.
Yes, thanks. Hi, Christine. I thought that was really interesting contribution, particularly in relation to the idea of how patents operate when fast diffusion is required. Something actually I haven't heard a lot of talk about before, but it's a very important point, I think. But there was something I need a bit more convincing on, which is the issue of the relationship between patents and the failure to diffuse in emerging markets in less developed countries. So you compared the Salk vaccine with and what happened there with the fast diffusion of polio and what's happened under COVID. I actually lived through the last major outbreak in Europe of polio in Cork in the 50s, so I remember it well. But the scale of polio in those days was, was really very limited. I mean, in the United States, there were only, I've just looked it up, 57,000 cases of polio in the peak year of 57. So to say that you managed to get the diffusion fast is fine, but of course it's a much bigger issue with COVID, with billions of people and having to produce vaccines on that scale. And I wonder whether we can in fact blame the patent system for this, because as far as I understand it, compulsory licensing, which you mentioned, does allow for the patents to be bypassed. In effect, I know that in an emergency they can be bypassed immediately, and even if there isn't an emergency, they can be bypassed, I understand, by the government's offering a price to pay a license, and then they negotiate, and an adequate price has to be agreed, but there's no definition of what adequate is, so there's really no, as I understand it, no limitation at all on the compulsory licensing. And even if a country doesn't have the facilities to produce under license, the TRIPS agreement allows for third-party developing countries to be able to produce for export to other less well-off countries. So it actually opens the space for that to happen, and quite quickly. So I was wondering whether the real obstacle to the diffusion isn't something else. It's either in the way the governments react, the way that the population is reluctant to take the vaccines, or simply the difficulties of manufacture, of speeding up manufacture. But that's I don't really know, so I'm just asking that question. Thanks.
Yeah, thanks, Killian. You have expanded the model to including other additional variables which might be considered. Thanks, Christine.
Yeah, no, thanks, Ken. Yeah, we did in the paper. We have got analysis of the use of compulsory licensing for AIDS drugs, antivirals, which has been used in a number of countries, in Brazil and India, South Africa, I think. And it has been successful, but it took a long time. And you have to, under the compulsory licensing part of TRIPS, you have to try and strike an agreement with the manufacturer, or the patent holder first. Only if you fail can you then apply for the compulsory license. And then, as you say, you have to compensate them at whatever is meant to be a fair rate of return. So it's a very slow process to use. There were vetoes that were put in on HIV. It wasn't an easy process, because the US delayed it for a long, long time on HIV antiviral drugs, and that had terrible impact on countries with high rates of HIV infection. Because, as soon as you take these antivirals, infection goes, and it's a curable disease now. So the compulsory licensing is, the evidence that we've found on it is slow. Still somebody has to pay for it. And your point about it's not, perhaps I didn't emphasize this enough. A patent waiver, which would be an alternative to compulsory license, isn't enough. What I hope to bring out on the polio vaccine example is that what went on with the development of the polio vaccine, and you're right, the numbers were much, much lower for polio, so a much easier situation to deal with, it's less infectious, was the networks. What were created, everything was open. So everyone shared information on these vaccines and how to develop them. And, they were adapted, in an international cooperation framework for local use, the development of the oral vaccine and so on. It was all done through an international network of people cooperating, and they were produced in different countries as well. But the production, we do need to produce vaccines in a much greater number of countries than now. It's too concentrated, the production. It just shows us, COVID-19 showed us how silly it is to have production concentrated so heavily in a few countries. And so we need to transfer. The patent waiver is not enough. What it would do is it would facilitate, make it easy, knowledge exchange and sharing easier, because you're not shrouded in secrecy and so on, and there's not you've got an open framework. And then you need to transfer the knowledge. So when Goldblum went from Israel to the US, and Russia got involved in further developing the oral vaccine from Sabin, these were all networks of scholars and researchers working together, and we don't have that. So you need to create that, facilitate that. But I think one of the things that did facilitate it with polio was the fact that there was not a vaccine, not a patent for it. So yeah, I think it's a necessary but not sufficient condition to waive the patents. The next thing you need to do, and we need to be doing this anyway for other reasons like promoting real income convergence, is to diffuse innovations more widely. The biggest thing that is holding back, one of the biggest drivers of income per capita is innovation. It's the missing factor in the production function. It's innovation. So if you can spread that and diffuse it more quickly, you can also solve problems in inequality of income. And that's a much bigger project. And I mean, I didn't have time to go into it, but the way to do it is through all the innovation. The Europe did this, developing regional innovation strategies, where you do network scientists and build up capacity through education, through developing science networks. And SOAS can do some of this. I mean, if SOAS can do this successfully, partner, not to take the best scientists, as our director said, and bring them over here, but to partner with, have visits, but to partner research organisations in the global south with us, then you can speed up development. You can deal with a lot of problems simultaneously.
But isn't that being done in India? I mean, isn't there a large, I mean, because the TRIPS allows the third country to produce and export pharmaceuticals that are compulsory licensed, then there's an incentive for a knowledge exchange with those third countries that do have the facilities to do that. And I had understood that a lot of the vaccines for AstraZeneca certainly were produced in India.
Yeah, but not under compulsory licensing.
No, in this case, not under compulsory licensing. Yeah.
That's right. No, India does have vaccine production capacity. So does South Africa to some extent. But we should look at where that capacity is nationed at the moment and just build it up. It's possible to do it, and it would bring huge benefits for us to do it, not just for public health, but for, as I say, for promoting economic development, expanding knowledge, doing all the things we should be doing in a university. But yeah, I don't know of any cases you mentioned, Kieran, that the governments can do it without issuing a compulsory license. I don't know of any cases. We didn't look at any cases where that's been done. Are there any? Do you have examples of that?
No, I was saying that there were two cases of compulsory licensing. There's the emergency case, and the case where there's no emergency, and where there's no emergency, you do have to negotiate. But I understand it's nothing like the length of time that it's. You're saying that it takes a long time, and I think there's a 3-month period or something like that stipulated. But if it takes longer than that, and if it's taking 2 years, as it has done, then I think there must be some other reason other than the legal aspects of it that is causing the delays.
What we looked at was not. There is no compulsory license or patent waiver at the moment, or certainly no issue on COVID-19 vaccines, but on the HIV antiviral drugs. It took a long time for those to. We have got the case study evidence in there. I was just trying to find it in the paper. It took a long time for those to be produced under compulsory licensing. But there are examples of it being done, and they've been relatively successful in reducing the number of HIV related deaths and HIV infections. There's some success from that for HIV, but it's not not within the time frame that we need for COVID-19, I think, because it's a much more infectious disease.
Thank you both, Kilian and Christine, on that discussion. So we take a comment from Makin.
Good afternoon, and thank you, Christine. It was absolutely wonderful. And thank you, Victor, for inviting us. My field of specialization is comparative intellectual property and comparative industrial property. So I'm not going to hijack your presentation and turn it into a legal question, but I was very interested in your first 5 or 10 minutes of your presentation when you were saying that unfortunately we failed to find universal raison d'etre or justification or philosophy for patent law. And this would be my first question, would be followed by 2 more. So the first question is, don't you agree with me that it's impossible to find a universal justification for patents, because patents is like any other legal discipline, is always linked to a specific jurisdiction. And therefore, if we want to find the justification for patents law in the United States, we start from Article 1(8) of the American Constitution, which is the utilitarian or functional approach. If I want to find the raison d'etre of patents in France, I have to go to the Revolutionary Assembly and the concept of natural right. And unfortunately, in the United Kingdom, between these two extremes, we have United Kingdom, which adopts very simple philosophy that can be summarized in 2 words: anything goes. And do you agree with me that finding universal justification is impossible, not only in patents law, in any other discipline of law?
Well, I bow to your greater judgment in terms of the law, the legal side of it, but that really wasn't the point I was making in the introduction. It's just that I was looking at it just from an economic perspective, rather than trying to argue it in terms of justice or legal perspective. And the economic case was never settled. There was just this debate, and then patent law was introduced, but the two things seem to be quite separate. So it's not that there's an overwhelming amount of economic evidence that patents are beneficial. There was very mixed evidence, and we're just left with what's called the patents controversy in economics. And then patent law was introduced. Well, patent laws have been introduced for years, but patent laws were consolidated under TRIPS. But whether we need them or not, this is much more my perspective from an economic perspective rather than from a natural justice point of view. From an economic perspective, I think the jury's out. We don't know. There's no clear evidence that they do bring benefits, and there's some evidence that they bring costs. So that's the point I was making, rather than trying to encroach on your field of expertise. I'll leave that to you.
Thank you for clarifying that. Christine, my second question to you follows naturally from what you've just said. In 1951, Edith Penrose, because she was under threat of getting arrested in the United States, so she had to escape the United States, and she came to United Kingdom, and as if she hasn't suffered enough to completely purify her soul, she ended up working for SOAS. The last thing she wrote in the United States before leaving the United States was a book that sadly we don't have at SOAS Library, that's called The Economics of the International Patent System. And I'm going to read to you a statement she made in that book, and I would like you to tell me what you think of it. I am quoting her verbatim now. If national patent laws did not exist, it would be difficult to make a conclusive case for introducing them. But the fact that they do exist shifts the burden of proof, and it's equally difficult to make a really conclusive case for abolishing them.
Well, I think I certainly agree with the first part of it. I think it is difficult to make a conclusive case for abolishing because the evidence is not clear cut. So I think what I would say on that second point, though, I wouldn't agree with it categorically. On the second point, I think what we've tried to show in this paper is that there is a class of patents, and perhaps it's quite a narrow class of patents, where there is a very strong case for abolishing them, and that is vaccines. And so that's the point we've made. We've just said, instead of just treating them all in the same way, and because the evidence is mixed and so on, we're not saying abolish patents. We're saying in the case of patents to protect common poor resources like public health, particularly these vaccines for COVID-19, there should be other ways to incentivize R&D. And actually, most of the R&D in any case is financed for vaccines from the public purse, not from the incentive. So there is a case, a narrow case, but that's interesting, yeah. And of course, we should definitely get her book in the library. But I have read that. I was familiar with that quotation. Yeah. But thank you for reminding me of it. Yeah. So just to clarify, what we were saying is the evidence. The patents controversy is not solved. There's evidence in both directions. What we've tried to show is that for common pool resources, particularly for vaccines and certain types of green technologies, it makes sense to waive the patents, or even just to. So, we've argued for patent waiver whenever WHO declares a pandemic, the patent should be waived, and for vaccines. That's what we said. So, agree in part with the last bit, but disagree for common pool resources.
I think the last comment, this is not a question, but thank you so much for answering my two questions. I think the last comment I would like to make is that sadly, we seem to forget the history or the evolution of patent law. When patent law was first introduced in the United Kingdom in 1624, Section 6 was introduced as an exception. So patent law was introduced as an exception. So the 1624 Statutes of Monopolies abolished all monopolies and left the patent system intact under Section 6. And we have a very bizarre rule of interpretation in law that any exception should be interpreted or construed narrowly, and any general principle should be interpreted or construed broadly. Funnily enough, or bizarrely enough, or oddly enough, whilst patent law was introduced as an exception in today's world, the scope of which is normally interpreted or construed broadly.
Yeah, thank you for that comment, and for that. I'll have a look at that. That's really helpful. And I'm very grateful to you and your knowledge for sharing that with us. I mean, one of the things that surprised me when I started looking at this, I kind of knew there was never agreement in economics about patents, but what surprised me is how many countries developed without patents at all. Netherlands abolished its patent laws, and then they came back in again. So the history of patent law is very interesting, because people seem to think it's been there forever, but it's much more complicated than that. And thank you for sharing your expertise with us. Yeah, thank you for that.
And Christine, the more you read, and this really, I'm sorry I occupied so much of the frequency spectrum. I do apologize, but I don't get out much. So if you really dig into the history of UK patent law, in actual fact, it can be labeled as a charter for thieves. It was initially introduced to get all new inventions from abroad and to introduce them in the United Kingdom without any protection. So in actual fact, whilst the patent law in the United Kingdom was introduced to copy inventions that were made available elsewhere, now in the world that we live in, we try to punish any developing country that tries to copy an invention that is filed in a developed country. And I will stop here. Thank you so much for taking my questions and being terribly, terribly patient with my comments.
No, absolutely not. I think, Markin, this is a very good mix of law and economics. The two fields, I think, go very well together. And you have given us absolutely helpful insights. And I think this will enhance the productivity of Christine and colleagues, and enhance the value of that paper. Thank you indeed, Markin, and thanks, Christine, for appreciating those comments. Jaideep.
Hi, Christine. Thanks for the presentation, and it was really interesting. It makes me think about quite a few things at the same time. So it's like it's even difficult to sort of formulate just one question. But one of the things so if I were to summarize in my mind, like the taxonomy, it's used to sort of differentiate between things with network externalities. So even with vaccines, like the vaccine for tetanus would be treated differently than a vaccine for a transmissible or disease, right? Mm-hmm. So now, I mean, if I think about it from this perspective, when the first vaccine was invented, right, where would the taxonomy taxonomy have been? Like, I mean, this is kind of, innovation is a dynamic concept, isn't it? So when we build up a taxonomy like this, how do we know what the network externalities will be before? So when you think about the rules of the game, when you try to define them like this beforehand, and you're thinking about patents as long as they exist, and of course we've had this discussion now where, like their justification is in question, but if the incentive generated by patents is to be able to sort of make people like invent new stuff or innovate, then how do they know that their work will not be construed as having this kind of network externality, this that's going to then just basically outright take away all their work or their profits. So how do you define the rules of the taxonomy in advance of like not being able to look back and then classify things as you have?
Yeah, that's a good question, Jody. Thank you. Let me think about that. I mean, I think so it depends on how transmissible. So if you've got very transmissible diseases, I suppose it's going to be related to transmissibility of the disease. If you wanted to get down into that, actually, the network externalities point. I mean, you could view it as network externalities. You're quite right, and I did mention network externalities. Really think of network externalities in terms of getting locked into carbon polluting technologies like we've got a distribution of petrol stations. It's very hard to switch to electric vehicles because you're locked into the network externalities on the petrol stations, and you need to get the network externalities on the charging points, but we don't have that. So that was kind of, but you're right, you could view the vaccines as the same thing in a way, that the more people that are vaccinated, the higher the efficacy of the benefit of the vaccine. You can view it in that way, exactly the same way. And so I suppose the key thing then would be the transmissibility of the disease. So you're right, some vaccines, like vaccines for dengue fever or something like that, it's not transmissible human to human, so the network externality is going to be less. And but I think that of course, these vaccines so it's an interesting question, and one, that I need to think about more. We need to think about more in the paper. But I guess in the case of COVID-19, all of the vaccines were developed after the event, when everyone knew what the benefit. Actually, I suppose people still don't know the true transmissibility of it, because every variant we get seems to have higher transmissibility. But I'm sure, I need to give some thought to that. But I think it's an important point, so thank you.
Thanks.
Thank you very much, Jaydeep, and thanks, Christine, for the feedback. Any further comments? I know we are almost running out of time, but let me see if there are any comments in the chat and any hands being raised for comments, observations. Okay. I think, once again, Christine, thank you very much, and extend our thanks also to your co-authors. This has been a very, very rich paper, interesting, very well received, and I think very good feedback from the audience in terms of the detailed comments and questions. I think this is research that's going to go a long way. I can see it extending to many directions, including to finance, including, I can see we have the law components already now introduced into the discussions in a very rich way. And I think there are also a number of regulatory issues that will need to be further developed for impact. Because I think the regulations on climate change risk and CO emissions, very important. But it's always the regulatory arbitrage that is the problem. that the legislation has to cut across all the countries. But of course, I think in terms of the game theory you are invoking here, if a number of countries lead by adopting those regulations, then there will be a foreign activity from the other countries that are not adopting, and eventually we should move from statics to dynamics, whereby, you know, eventually almost all the countries in the world, or almost all the countries, have adopted those regulatory requirements, or complied to all those regulations. So, you know, great work, great food for thought, and we thank you very much, you know, Christine, and I thank you very much all participants for the ideas. We'll share with you the paper and the presentations in due course. It's work in progress, so I think you know, Christine will very much appreciate the further feedback on this work, which could end up becoming a big research agenda in its own right. So, you know, thank you indeed. And we see you here next week on an equally interesting presentation. Thank you indeed. Thank you.
Thank you.